I'm Dr. Magda El-Diwani, Associate Professor at the University of Texas Dental Branch in Houston. In this video, we will demonstrate making an accurate alginate impression. Alginate impressions are used to register and reproduce the form of the teeth and oral tissues and the relationship with each other. The impression gives a negative reproduction of the oral tissues. A positive reproduction of the tissues, a model, is then made by pouring dental stone in the impression and allowing it to harden. Impressions can be made of several teeth, a quadrant of the mouth, or a full arch. They can be used as diagnostic models for patient education or for the fabrication of custom trays for home bleaching. This demonstration will concentrate on making an accurate alginate impression. Step 1. Materials needed. The required materials include alginate powder, either in bulk or in a pre-weighed sealed package, a water measure, maxillary and mandibular impression trays, a rubber bowl and spatula, tray adhesive, a small dish, a small brush, a lab knife, rope wax, and disinfectant spray. For this demonstration, we will use Vescadine disinfectant. Step 2. Impression tray selection. This demonstration will use disposable perforated plastic stock trays. Follow these steps to select the appropriate size of maxillary tray. Stand behind the patient. Support the patient's head and maneuver the seat to a 45-degree angle at the elbow height of the operator. Using a mirror in the left hand, retract the patient's cheek. With the tray in the right hand, rotate and insert the tray. Now check for the proper extension of the tray. The posterior end of the impression tray should be just distal to the maxillary tuberosity. The anterior portion of the tray should cover the anterior teeth, with the incisal edge and cusp tips contacting the flat arch portion of the tray, about 6 millimeters from the raised flanges. To select the mandibular tray, stand in front of the patient. With the mirror in the right hand, retract the cheek. The left hand should rotate the tray as it is inserted in the patient's mouth. Check for tray extension. The tray should cover all the teeth and the retromolar pad, and about 6 millimeters from the raised flanges of the tray. Properly selected trays allow 1/4 inch or 6 millimeters clearance. Trays may be modified using rope wax or modeling compound to ensure that any extension of the alginate is well supported. The goal is to avoid unsupported alginate impression material. Apply tray adhesive to the impression tray to ensure that the alginate will not pull away from the tray upon removal from the patient's mouth. Allow the adhesive to dry for 3 to 5 minutes. Make the mandibular impression first. Patients with viscous saliva should first rinse with mouthwash. Position the patient for maximum operator visibility and patient comfort, and standing in front of the patient to make the mandibular impression. Measure the recommended amount of water into the mixing bowl. Using water at room temperature will give a working time of 2 minutes. Warmer water will result in a faster setting time. Cold water will slow the setting time. Add and mix the powder slowly into the water. Then use the flat spatula blade to press the material to the side, while rotating the bowl to remove air bubbles. Continue mixing for 45 to 60 seconds. Load the tray with alginate, beginning at one side. Carefully fill the tray without trapping air and without excess material at the posterior border. With the mirror in the right hand, retract the cheek and rotate the tray in the mouth with the left hand. Center the tray over the teeth and seat it. Have the patient raise and protrude the tongue to get the lateral border from under the tray and to clear the posterior lingual flanges. Ask the patient to retrude the tongue and hold it in rest position. Hold the tray in position. Pull the cheek and lip to mold the buccal and labial vestibule. Wait for 3 to 4 minutes to allow the material to set. Do not leave the patient unattended or the tray unsupported. Break the seal by gently pulling cheeks and lips outward. And remove the tray with a snapping motion. Rinse the impression under tap water to remove saliva. And spray with a disinfectant. Shake up excess solution and inspect for detailed reproduction of hard and soft tissues. Vestibular roll, buccal, labial and lingual frena, lingual vestibule, retromolar pad area, and no voids. Remove unsupported material with a knife. Cover the impression with a damp gauze or napkin. Storing the impression in either a wet or dry environment will cause a gain or loss of water, resulting in distortion of the impression. Ideally, the impression should be poured with stone within 12 minutes after removal from the mouth. However, it also could be bagged for transportation. Some extended storage alginate are stable for up to 5 days if stored in a baggie. These impressions can be sent to a dental laboratory for fabrication of models. Make the maxillary impression second. Again, patient with viscous saliva should first be asked to rinse with mouthwash. Position the patient for maximum operator visibility and patient comfort. Mix the alginate as before. Load the tray and avoid trapping air. Stand behind the patient and with the mirror in the left hand, retract the cheek. Use the right hand to rotate the tray into place. Remove the mirror and seat the tray upward and forward. Do not overseat the tray and allow the material to flow over the flange and forward. Avoid forcing the material into the back of the throat. Hold the tray with one hand and pull the lip and cheek with the other hand. Switch hands and repeat on the opposite side to allow material to flow into the vestibule, to mold the border, and to free trapped air. Continue passive support until the material sets. Do not leave the patient unattended or the tray unsupported. After 3 to 4 minutes, stand in front of the patient and gently elevate the lips and cheeks to free the tissues from the alginate and to break the peripheral seal. Dislodge and remove the impression in a single rapid motion. Rinse the impression under tap water to remove saliva. Spray with a disinfectant. Shake off excess solution and inspect for proper reproduction of hard and soft tissues. Vestibular roll, buccal and labial frena, tuberosity and hamular notch. Remove unsupported material with a knife. Cover with damp gauze or a napkin. Be sure to place the impression in a plastic bag for transportation to the laboratory. Again, storing the impression in either a wet or dry environment will cause a gain or loss of water, resulting in distortion of the impression. Ideally, the impression should be poured with stone within 12 minutes after removal from the mouth.